A 30-year-old lady suddenly gained weight without intending to. She also noticed some abdominal hair distribution. She started growing hair on her beard, on her chest, and tummy. Then there was one other thing that she noticed. She hasn't seen her period in the last 6 months, and she was worried, which made her do a pregnancy test, which came back negative, given the fact that she has been sexually active since the past 3 years and she's been struggling to get pregnant. So when she came in, seeing her, I could see some acne on her face. With everything she had said, there was one condition that was popping on in my mind. Previously, we would call the name of the condition polycystic ovarian syndrome, but just recently the name has now been changed to polyendocrine metabolic ovarian syndrome, PMOS for short. Previously, it was called PCOS. Now let's dive right into it. Why is it called polyendocrine? Because it can affect the endocrine gland. So the pancreas is an organ that produces insulin, and PMOS can make your body to be insensitive to insulin, thereby making your body to produce more and more insulin, which then increases your appetite and can cause weight gain. Now, in women who have PMOS, they can also have increasing level of cortisol, which is a stress hormone. Increased level of cortisol in the body can then affect the sex hormones, the LH and the FSH, thereby inhibiting ovulation. Now, in PMOS as well, there is increased testosterone level, which is what is responsible for the male pattern baldness. You start losing hair, and then you start growing abnormal hair in areas that you do not want to, called hirsutism or male hair pattern distribution. Women can have polyendocrine metabolic ovarian syndrome without having polycystic ovaries. However, I still decided to request an ultrasound of her tummy, and the reason why I did that was not to confirm if there was any polycystic ovaries, because her symptoms have already confirmed that this lady has PMOS. But I still did anyway, and I'm going to be telling you why. So women who have PMOS are at an increased risk of womb cancer, and ideally every woman should have at least 4 periods in a year, unless if they are on Mirena coil or they are postmenopausal. So before she had seen her period in 6 months, I requested a pelvic scan to check for thickness in the lining of her womb. I requested blood test, and when the blood test came back, it confirmed my suspicion. So now, because PMOS or PMOS can also increase the risk of heart attack and a stroke, I put her numbers in a medical calculator to check for this risk. And the good news is that it came back low. So we discussed about lifestyle changes, diet, exercise, and things that she can do on her own in order to lose weight. She didn't want to be referred for any weight loss program. She wanted to try on her own first, and we agreed on that. So alongside that, we discussed about referring her to PMOS clinic, where she would see a hormone specialist to start her on metformin. Metformin is a medication usually used to treat type 2 DM, diabetes. However, because in women who have PMOS, their body is not sensitive to insulin, which was what I mentioned earlier. So metformin would help their body to be sensitive to insulin, thereby decreasing production of insulin and reducing their appetite, which hence help with weight gain. Now, when a woman has abnormal hair distribution pattern, acne, trying to get pregnant, feeling tired all the time, weight gain when not trying to, all of this could start to affect their mental health. And in this lady, it was. So we spoke about self-help measures to improve confidence, and then we referred for talking therapy. So I just wanted to let you know that if you are suffering from polyendocrine metabolic ovarian syndrome, you are not alone. There are ways that we can help you. Thank you for watching.